Hello, everybody. Welcome to the UNH Healthcare Forum, A System Under Pressure. We're so pleased to be here with all of you today, and we have a wonderful group to discuss how our system is faring and what kind of pressures it's experienced during COVID. And I'm pleased to introduce our sponsors for today's event, Heather Staples-Lavoie, who is the president and CEO of Genia, who has shared a brief video message, which we're going to play for you. During her 30-year tenure in healthcare, Heather has led startups, health plans, and provider organizations, all with innovation and transformation as her top priority. She's even worked here with us at the Institute for Health Policy and Practice in the past. She is a sought-after national speaker on healthcare issues and dedicates her expertise to the UNH Manchester Advisory Board, as well as a number of nonprofits. She's also an incredible athlete and runner and racer in her own right. She's a proud parent of UNH student Henry Lavoie, class of 2024, and we want to share this message with you.
The healthcare system, and especially the people, physicians, nurses, allied health professionals, administrators, and more, have performed heroically this past year. We all owe them our appreciation, our gratitude, and as I've said before, our continued commitment to COVID-safe behaviors like wearing a mask, socially distancing, and getting vaccinated when it's our turn. As much as the healthcare system has met the most acute challenges presented by the pandemic, this past year has revealed problems that need our collective efforts to be addressed. The first is interoperability. We've made some progress with interoperability over the years, but we are not there yet and very much need to be, even more so to manage pandemics. Take lab reports as just one example. In the area of lab reporting, half of lab reports submitted to public health lack a patient address or zip code, key demographic data elements used in identifying infection clusters and localizing disease hotspots. The second area is deferred care. Too many people have postponed healthcare, myself included. An Urban Institute study found that as of September 2020, 36% of adults have delayed or foregone care. 76% of adults with delayed or foregone care have one or more chronic conditions. And what's even more troubling is a person's likelihood of deferring care rose with the number of chronic conditions. Nearly 50% of adults with multiple chronic conditions delayed or went without one or more types of care in the past year. And lastly is the area of physician burnout. Physicians have been burned out for years and they have been hard hit by the pandemic. In the early days, many closed their practices and others shifted to telehealth. Most suffered financial losses, and too many others have contracted COVID directly. As of December, more than 2,900 healthcare workers have died from COVID. In January, Medscape reported work-life happiness among physicians declined 20% in 1 year, from 69% to 49%. As important as gratitude is, it's not enough. Once and for all, we must commit to fixing the systemic physician burnout issue that we face. So 1 year in, I'm sobered by the ongoing pandemic, the growing tallies of deaths, the many people who have COVID fatigue, who've lost their livelihood, who mourn the death of a loved one, or who have relapsed or used substance misuse as a coping strategy. I'm simultaneously buoyed, though, by the resilience of many around me, the increasing availability of COVID-19 vaccines, and all of the COVID-19 healthcare innovation yet to come to fruition.
Thank you, Heather, and thank you, Genia. I'm now going to introduce our panel for today's discussion. And just so you know, we are welcoming questions in the question and answer box for all of you. So please share with us your pressing questions for our great panel. My name is Lucy Hodder. I am the Director of Health Law and Policy at UNH Franklin Pierce School of Law, as well as the Institute for Health Policy and Practice. And as such, I get to both be involved with educating amazing health law students at the law school and supporting them as they enter into the community, work at law firms, support many of you in their residencies. I also work with an incredible team at the Institute seeking to transform healthcare, aging, public health, system transformation, and payment reform. So we have been hard at work during this pandemic and really interested in your thoughts on transformation and how we move forward. Danielle Amero, also a UNH grad, is with us today. She's the occupational therapy manager at Wentworth Douglas Hospital and also the legislative chair of the New Hampshire Occupational Therapy Association. And I can't say enough about the work that our professional associations and the caregiving professions have done during this pandemic to bring voices together, bring messages out to the community, and to really support. It's just been incredible to see. So thank you, Danielle. Melissa St. Cyr, who's also a UNH grad from Franklin Pierce School of Law, 2016. She is the Chief Legal Officer for the Department of Health and Human Services and is going to talk with us a little bit about what that experience has been like during the pandemic. We're so lucky to have you here today, Melissa. Thank you. And Jean Harkless, who's an associate professor and chair of the Department of Nursing at the University of New Hampshire. Thank you all. I'm going to ask you, each one of you, to offer us a little bit about what it is you do every day, so you can explain what you've seen the impact of COVID to be. So Danielle, I'm going to ask you first. Tell us a little bit about what your work as an occupational therapist entails and what you've been seeing.
So I work at a Seacoast hospital, a community hospital. We have about 16 OTs on staff. We see the inpatients and the outpatients. So in any given day, we're working to bring people who have suffered any kind of injury or illness back to their fullest potential. We look a lot at the activities that they value and try to restore their ability to perform those activities. And we really saw a huge shift with COVID because our elective surgeries were shut down, all our elective services were shut down for kind of an extended period of time, which really speaks to people delaying care. So when they started coming back, we started seeing people who had been injured maybe for months instead of weeks, who had put off having joint replacement surgeries, truly because they had no choice. So UNH, my education at UNH really prepared me because I had an excellent foundation in activity analysis, thinking on my feet, clinical reasoning, and we really had to pivot and change some of those things to increase access to telehealth and to just being creative with our patients and doing the best we could with what we had for them. So it was a challenge, but it was a good one.
Thank you so much, Danielle. And we have a lot to ask about what you're seeing patients and what their resilience is and how we get back to a place where we need to go. Melissa, I'm going to turn to you now. Your role as the Chief Legal Officer at the Department of Health and Human Services, I'm sure, has spanned every single issue possible. I know if we all think back to a year ago when we were thinking this might be 2 weeks and we didn't know really what emergency powers were involved and who actually had the authority to spend the money and whether our professionals could work in off-campus locations. I mean, just can you tell us a little bit about what it's been like in your position during COVID and how it's changed? And second, thank you.
Sure, absolutely. Thank you, Lucy. So as the Chief Legal Officer for the Department of Health and Human Services, I'm responsible for the Office of Legal and Regulatory Services here at the department. So that oversees all general counsel, anyone who's, a bunch of lawyers who represent the different areas of the department, from Medicaid to our economic and housing stability, which deals with homelessness and assistance to needy families, to Division of Youth and Families, Children, Youth and Families, and Division of Long-Term Supports and Services. So we have attorneys that act as general counsel for all of those areas, as well as the regulatory side of things. I also oversee our Bureau of Licensing and Certification, which is licensing of healthcare facilities, childcare centers, and then our ombudsman's offices and our administrative appeals unit. So all of that, spans all of the department generally to begin with. But when COVID began, you know, it just kind of kicked everything up into high gear, and we ended up dealing with a lot of things. And me personally, we got called in to the Emergency Operations Center the day before the state of emergency was declared by the governor. We were asked by the governor to come in, the senior executive team for the department, and we basically, you know, I feel like I never went home after that time. I essentially just lived there, you know, all hours of the day. I did go home to sleep for about 5 hours a night, and then I went right back to work. And so, you know, we had lots of tasks, and you know, we had PPE was big at the very beginning. How are we going to secure PPE, personal protective equipment for the hospitals and healthcare workers that needed it? There was short supply all over the country, so that was a challenge. Also, getting the funding. How are we supposed to find money to purchase this? We didn't have any funding yet from the federal government, so originally it was how do we spend you know, state money to be able to get PPE. And then the state offices started closing, the legislature closed. They were in the middle of session, and we deal very closely with the legislature just for things related to the department and healthcare in general. We saw health facilities closing. You know, as Daniel mentioned, you know, how can you provide core services while you're also trying to respond to the pandemic, assisting and getting calls through those. We had a lot of questions about public health. We get information, as you can imagine, for public health, a lot of personal information from people all over the state who are positive for COVID. So how do we protect their confidentiality? But then also, you know, alert the public and notify the public on you know, what is this health crisis, and how can we protect them, and what's the level of information that we can give out while protecting privacy for individuals. There's a lot of conversations and discussions around emergency management functions, and whether or not there's a statute that allows for immunity for certain emergency management functions. So we're in the state of emergency, who's handling the emergency, who gets immunity and who doesn't. And then the emergency orders, there were lots of emergency orders by the governor. So all of these things, like clinical trials at hospitals, to whether or not telehealth is allowed, to how do we hold public meetings as a state under our public access laws, to out-of-state medical providers and emergency funding for childcare. And then the relief started coming in from the federal government. So how do we deal with all of the money that's coming in? What are the appropriate uses? What authority do we have to spend that money? What are the appropriate uses of that money? Are they in line with the grant that we're getting from the federal government? And how do we move forward and get that out to the public, the people who actually need it, the businesses and individuals? You know, and then there's the document reviews of public health and the daily conference calls with towns on how they can, you know, respond to their pandemic. There's how do we deal with the homeless population, especially when, you know, they can't socially distance, or they can't do, you know, they have to go into stores to, you know, get food and other things. And then the waivers, we have a lot of regulatory authority, and the federal government tells us what we can and cannot do with certain things. And then they said, well, we're going to expand your ability to do certain things, although we usually have restrictions on those things. Now we're going to expand that authority, and we're going to grant you waivers as a state. So we had to, all of our programs that we administer, Medicaid, had to change. So we had to, you know, interpret the waivers that we were getting from the federal government, and then implement those changes. How are we going to do electronic signatures as something that wasn't done before? So there's just, and then obviously the lawsuits that come into play, the concerns that, you know, the concerns around discrimination, individual rights, and all of those things. So I mean, that's just very high level what we dealt with. And there's so much more, but that gives you a flavor.
And you're still standing. We're so and you know, we are going to be very interested to hear how the partnerships with UNH and with community providers and public health have helped support you, because we're hoping some of those pathways have really made a difference through this year. But you know, I'm picturing, as you talk, Melissa, this incredible spreadsheet grid of all the rules and regulations and changes you turned off or had to turn on to make what we see as an emergency response happen. So I imagine shifting that into the future is going to be something you're going to tell us a little bit about. But before we get there, I want to turn to Jean and say, Jean, you've been working to try and educate and support and help our students and our nursing students who are in dire need right now. And as we've heard from Danielle, the impact on healthcare workers is so hard. So what have you seen, and what has the nursing department been doing, and how have we been supporting education and education of the kind that we need now around telehealth and et cetera?
So we all lived the experience of the last a year ago now, when we were told in early March to look towards perhaps a closure of in-person education, but not a closing of UNH education. So it was that transition point that we all saw coming, but we didn't know what steps were going to be taken or how dramatic this was going to be. And then spring break was the transition point. And at that point, all our faculty across all of university was told that students were going home, education was to continue, and we were to provide the best education we could for the in this really quick transition. Nursing had a particular challenge, as did OT and all the other clinical offerings we have at CHHS, in that how do you proceed then with what's really important is that direct clinical care that our students benefit for, that Danielle was saying she got such an excellent education at UNH providing. So we had a real challenge because clinical facilities last spring were closed to us. And we did have to go to case-based learning. We had to engage a lot more online resources. We were really pleased that we had some of the flexible resources to use those teaching learning materials that are costly, but we were able to deploy to our students and continue the pre-licensure education. And I also serve on the Board of Nursing in New Hampshire, so I'm a direct recipient of all those changes that Melissa was talking about, that at the Board of Nursing, we had to make judgments about what could be allowed for nursing education, what was under the statute, what was allowed under the rules and regulations, and how do we make sure that all of nursing education in New Hampshire stayed at high quality, that we could know that it was going to meet our standard. So, but we not only have undergraduate students at UNH, we also have a lot of graduate students. We are actually at a total enrollment of about 500 students in nursing at this point, and that goes from the Doctor of Nursing practice level, which those students were on the front line of working on innovation and change as their institutions were really struggling with how to address this pandemic. And our master's students and family as nurse practitioners working in the community, they were also in this position of primary care, and all services needed to continue. And at what level were they going to be able to engage as students, and what level they were going to continue their own nursing practice wherever that site was. So we planned for the spring, and then we worked over the summer and to make sure that our fall was going to be as clinically intensive as we could make it. And except for long-term care centers, we were able to return to all our clinical sites with our students. And our students did a yeoman's job at preparing to understand all the infectious disease precautions, to make sure that all the faculty teaching was up to date, and they were going to be as safe as possible within the learning situation. But it was that time where nurses, it was almost like past as prologue. Nursing is a risky profession, as is OT. Any of our direct care disciplines puts people in the front line of care. And we know what to do to prevent, infection, and how to keep ourselves as safe as possible. But it's not a no risk, it's a lower risk situation. And we had to prepare our students for that. And we think we did a really, really good job. We then found out that our clinical sites, we kind of knew this, they were looking to our students as being some support, both for the vaccination clinics as well as provide some clinical care during their stressful time. And we did work with our clinical sites to rearrange some of our care, some of our curriculum, some of our course sequences, some of our calendar to make sure that we are providing a really great learning opportunity with great academic support, but also meeting some of the clinical needs of our partnering organizations. And that has made us really think very differently about our curriculum. And it's really been an added impetus to do some of the changes that we were growing into anyway. So it's been both, it's a crisis, it's a challenge and an opportunity, right? It's an opportunity to make really important changes, but it's also very stressful with what it means for operating a system that's in the midst of change. So
Thank you, Jean. And it's just been so incredible. I work with a number of nurses and occupational therapists and social workers at the Institute, and just watching leadership and frontline workers embrace this change of how do we continue to care for our patients, and how do we continue to innovate during this really stressful time of risk, as well as use all these new tools that we might have available. Just so much respect for what the college has been doing to try and bring all that together, and hear all the voices. And I'm going to turn to you, Danielle. Your story, I mean, both the occupational therapist whose sort of number one mission is to bring people out to be their fullest self. How has that risk around pandemic illness and need to incorporate sort of telehealth or telepractice been for occupational therapy? And what do you see as the challenges or opportunities going forward in your profession, given what you've learned?
So the risk, a couple things. So on the inpatient side of things, I know my therapists were very frustrated because it took so much time to put on all the PPE, and it was so hard to communicate with the patients. It really impacted the amount of care they could show them, because there were so many barriers. They did have a system of using iPads with the patients in the rooms to limit the number of people having to go in and out of the rooms while still maintaining contact. But my therapists were right there on the front lines, you know, working right with the COVID patients. And there's more recent surge. We actually had far more COVID patients in our hospital in January than we did last spring. My team handled it like true champions. They were really great. On the outpatient side of things, it presented a lot of challenges because we were really worried about our more fragile patients, you know, our elderly, and initially Medicare did not cover telehealth. Governor Sununu and Melissa's office acted really quickly and allowed Medicaid and insurances registered in New Hampshire to be billed for telehealth. And we spent a great deal of time in our leader's office kind of trying to keep up with all the executive orders, the emergency orders. Medicare really took their time, and it took probably till summer, I think, and before we could reach out to those. And it was frustrating, but once we were able to, it really challenged us to think outside the box, because we're hands-on kind of practitioners. We like to really be touching and like doing with our patients. So to try to do that through a screen, just much like all of us are now learning how to conduct business on Zoom, was a challenge. But I actually worked with a young person with an orthopedic, a fracture and a surgery, and his mom did not want to bring all her children into a hospital. We weren't really allowing that because we can't have visitors. And we worked through a whole treatment sequence of getting his range of motion back. My specialty is hand therapy. Via Zoom, I got to see a lot of dirty laundry, and he was delightful though, and he did everything I asked. But it was a really pleasing experience, and my therapists have really stepped up and like challenged themselves to make it meaningful and impactful in the same way the one-to-one in-person therapies are. So I think that's been a great challenge, and I think it's really the direction things are going to improve access, especially in some of our rural areas in New Hampshire. And and to those who have difficulty getting out or maybe nervous still. There's still a lot of nervousness in the community to come out to a hospital.
Right. Danielle, thank you so much. And it sounds like that being able to navigate has been really helped by some of the work that Melissa has done in terms of trying to create pathways. And Melissa, I'm going to turn to you, and I'm also going to encourage our participants to put questions in the Q&A for everybody. But Melissa, can you tell us a little bit about, the vaccine rollout and the issues involving the vaccine rollout? What has been the greatest challenge, and what do you consider to be sort of your greatest success in terms of how that's gone and the partnerships you've developed as that has come to fruition?
So obviously, I think our two biggest rollouts were the testing and the vaccine. Making sure that we had access for everyone to get tested and what that would look like. From my perspective, for testing and vaccines, a lot of the work behind the scenes was working with as Danielle pointed out, Medicaid, trying to get coverage for those things, ensuring that everyone who needed to get a test or needed to get a vaccine could get one. And so they were similar in the way that they were rolled out, in that, they were, it's a huge amount of work at the very beginning to kind of get the system in place, get it up and running, and then making sure that everyone has access to it. And that's always the biggest challenge. How do you educate everyone? And so, I think public health has done an amazing job in constantly updating guidance, constantly getting things out on the website, communicating as best they can. We have calls with the hospital association, with the nursing homes, with everyone to ensure that all parties are taken into account, and that we can move forward and get everyone vaccinated who wants to. So I think that's the biggest success, but there's so much work behind the scenes from systems, and I know everyone sees articles in the newspaper. I mean, there's always hiccups. There's always things that we're constantly working on behind the scenes to ensure that things happen. But the partnering is huge. We actually worked with UNH to assist with some of the testing that was getting conducted with our homeless shelters and childcare and other things where we needed work. Our state lab only has so much capacity to be able to do testing. We also don't have the infrastructure. We don't have a whole host of physicians and nurses to order and administer vaccines. So working with the associations, the hospital association, the nursing home association, home health association, everyone, and everyone that Jean has mentioned already, to get as many people vaccinated is really the key. And I think New Hampshire is incredible at working together and getting everyone on board and everyone on the same page so we can move that forward.
Well, and I know that UNH has stood up a CLIA lab and is testing students twice a week and staff once a week, and working with the state for sort of overflow and support, all in the span of a year. And I just think about you having to use the National Guard, and I know there was a moment of time when you're waiting for resources to come in, et cetera. So just, Jean, before I turn to you and talk about the nursing students commitment, Melissa, how important has been the federal legislation and the resources that have come to the state? I know that we don't often talk about the fact that, New Hampshire can launch the National Guard if you have resources, and you can launch public health workers if you have resources to pay them. How important has that synergy been?
It's incredibly important. We wouldn't have been able to do it without federal assistance. Many businesses and healthcare institutions were having a significant financial impact for the lack of being able to provide services and having to dedicate most of their time and energy to COVID response. And so with federal relief it's huge to be able to get them to where they need to be, get them at least to be able to respond to things, not just COVID, but people still have healthcare crises that are not COVID related at all. And so ensuring that the citizens of New Hampshire can, still seek out healthcare and get everything that they need is imperative. And without the National Guard, without the federal relief, we just wouldn't have been able to do what we did.
Thank you. And Jean, tell us a little bit about how the nursing students, you sort of turned their experience into a partnership and collaboration with some of the intensive public health needs that the state has been facing around testing and tracing and isolation and vaccination. How has that shaped sort of the pressures that we're under? How has that shaped the educational experience of the nurses, both undergrad and graduate?
I think the College of Health and Human Services made quite a really important commitment about 3 years ago into developing a telepractice center here at UNH in order to educate the next generation of healthcare professionals, social workers, OT, the whole range, recreation therapists, so that all our students could be prepared to work in what we know is the future of healthcare, which is less brick and mortar and more how to access people where they're at in their home, where they need the care. So that we did not anticipate COVID, trust me. I think many of us had a belief that some infectious diseases would be easily controlled and that we were not focusing as much as we used to. But some of us that are my age or older can remember large outbreaks of diseases and remember our own childhood experiences with infectious diseases that were quite life-threatening and quite scary for our parents and our families. Then vaccinations came along. And I have to say, even in my nursing career, vaccinations have changed the whole way we look at child healthcare and the way we provide services. The whole vaccination world is so amazing. And I think this lesson has been for all of us is to make sure that the next generation of healthcare workers deeply understands what infectious diseases can do to the healthcare of the world and what it means to really understand infection control as well as for vaccination. So that said, we're really proud of our telepractice center. We've been able to help the community, the New Hampshire community, understand better how to use telepractice across different disciplines. We stood up a small Project Echo through CHHS that helped institutions in our area learn more about how to do this. And that was really important. So then we come back to the fall for our nursing students, and we are making sure our students, again, are well prepared for clinical practice. And what we saw is that surge that Danielle was talking about. We saw that surge coming in early November. We knew that probably mid-October that it was going to be a tough holiday season for the acute care institutions that we partner with. With that, we saw an opportunity, both, again, a crisis, an opportunity and challenge, to offer to our clinical partners the opportunity to have nursing students over the holiday break with full academic support, them getting the academic credit they needed for their senior immersion, their senior practicum, which is really important to our students. It's about 260 hours of direct clinical care that we require them to have. And very quickly, with the help of the undergraduate faculty, really at the work of faculty, transitioned into a different schedule for our curriculum. And our partners said, yes, we'll take students. And we were able to place about 18 students, I think, over the holiday break, which really helped their clinical staff. Those students worked full-time with a shift, partnered with a registered nurse preceptor, and it was a win-win for everyone in that it really helped the clinical staff have support, and it helped our students learn in a very intensive and very immersive experience. And everyone was incredibly positive about it. And so we've really looked at how we're changing our clinical experiences and how we may schedule better and actually partner better with our facilities that are so generous with their teaching time and their support for our students. So now we're in the spring, and the governor did sign a ability for senior nursing students to be licensed as student registered nurses. A few students have taken advantage of that. Mostly what we've been able to do is to encourage students to continue their education, and they will, and to graduate as fully capable registered nurses in May. And we know that pretty much all of them have positions right now. They have been scarfed up by healthcare systems in our region, and we are very proud of that. But it's a testament to the need for more health professionals going into this workforce. We have an aging health professional workforce. We need this next young generation, and it's just more of a sign of the importance of the commitment that UNH has made to nursing and healthcare education globally.
Thank you so much. And that brings up one more point. Yes.
We're able to staff, we've actually staffed a lot of COVID vaccination clinics with our clinical faculty, and we were able to help at the Loudon racetrack the other week, among many other COVID vaccination sites that we've helped with. But that was really an exciting opportunity because we had nearly 60, maybe up to 80 students. I didn't get the exact number. We had nearly an entire clinical class at Loudon on that Monday, and actually been asked to staff up another one with as many students. And so you may be hearing more about that soon. So we're really excited about that.
Fantastic. And yeah, and that just brings me to a really good point that Heather Staple raised, which is, burnout, provider burnout, the number of providers who are retiring, the impact on providers around this, because it's not just the stress of exposure but seeing patients so sick and seeing the mental health impact on patients in the community. I mean, and just the acute issues that people are coming into the hospital with and seeking care for, having delayed care. So I could go on and on about how our providers are so stressed as a result of this, having been disassociated from their practices, some of their practices failing. Yet right now we've seen such joy as they are able to vaccinate and bring that public health, understanding that universally understood concept that vaccines can change the way we are living with this pandemic and can make us healthy together, and seeing the retired physicians coming back and nursing students and everybody coming around the vaccination process has just sort of, I think, given all of us some hope. But I want to turn to you, Danielle, and ask, what do you see? How do we support providers who've been through this, and yet we need them so much as the unraveling of the pandemic exposes, delayed care and delayed attention to need and new patterns of living and caring for ourselves? How do we support occupational therapists and others in that transformation going forward over this next critical period?
Yeah, I think there's a lot of catch up happening across allied health, across the primary cares and the providers. There's a ton of catch up, and we're just trying to all work together. I know Wentworth Douglas is up to almost pre-pandemic levels of outpatient care, and we're just doing our best to be busy and see as many patients as possible. And at a leadership level, they've been very supportive and thankful for the work, because I think morale was really starting to droop with the second surge. It was less fear and more fatigue. So there's been a lot of different things. I think telepractice has definitely made a difference. It's more efficient. The patients really actually like it. I think for providers, for medical staff, they can see more patients more effectively. So that's very helpful for everybody. And I think the support in the system is continuing some of those efforts that Melissa's made, like telehealth in New Hampshire. New Hampshire actually blazed a little trail with making the telehealth emergency orders permanent legislation. And so we can only hope and support that the federal government will do the same for Medicare. That has not been determined. but actually Jean Shaheen has introduced some legislation towards that and is working towards it. So I think that is a future trend, meeting the needs of the patient where they're at. Absolutely, as Jean mentioned. And then I think that will support our professions.
Wonderful. Thank you, Danielle. And we have a couple great questions that have come in. And, you know, I see one from a Franklin Pierce Law grad from 76 who's been instrumental in other states around standards of care and crisis standards, and really appreciate the input and the collegiality around that. And he just asked, and it's a good question for Melissa, you know, what do we see as our strategies regarding the next vaccination phase, Melissa? And are there ways to cope with or message around vaccine hesitation? If you have any thoughts on that.
So I probably would love to leave that question to our experts and our epidemiologists. I know that Dr. Chan has had a lot of interviews and put out a lot of information around, you know, the phases that we're in and also going forward. I know that he spoke over the last week around whether or not a booster would be required in the future and what that's going to look like. You know, I think that right now as a department, we're really just focused on getting as many people vaccinated as they want to. And we're certainly educating people, you know, every day on the benefits to the vaccine, and hoping that everyone in New Hampshire will take advantage of what's available right now. And so, you know, I think that we're in a very good place. We've vaccinated a lot of people, and we're moving through the phases very quickly, to the point that we're even closer to getting just the general population vaccinated instead of right now it's the 50 plus, which is 50 years of age or over, that are able to get vaccinated right now, or at least book their vaccination, schedule their vaccination appointments. So I think, you know, I think we're doing everything we can right now with the supply we have, what we've received from the federal government, to move that forward and ensure that everyone who wants to get a vaccine can.
Right. And I am watching you all, and New Hampshire has done something fairly unique, which is to hold vaccines for the most vulnerable populations and try and have a special outreach and home visiting approach to address minority populations and others who may not have access. So that's been incredible. Thank you for that effort through public health and your department. Just a quick question, Melissa, as you contemplate the next year, given the number of regulatory changes that have had to go into effect to manage COVID, what do you see as the biggest challenge during our unwind?
So I think the biggest challenge is ensuring that everything that has been done that has benefited individuals throughout the state, that there's no break in service, you know, kind of hiccup or concerns that, you know, people who should be and need to be eligible for services, that those services do not go away for them. And however we can, you know, ensure that we communicate, we can ensure that, you know, we work with it, because it's individuals, you're talking services through temporary assistance for needy families or TANF plans, to Medicaid eligibility for those who have low income and need insurance, to even our the regulatory side of things, our nursing homes that have a lot of regulatory and hospitals that have a lot of regulatory oversight, that some of what they were required to do, they don't have to do right now. So I think it's the communication around those, ensuring that they know that everyone that receives services or is regulated, that they know when those timeline, those, you know, those drop dead dates are, when they need to apply, and just the communication's really going to be key for everyone in the state. And so I just encourage everyone to, you know, listen, look out for all of those dates and timelines, because we're going to do the best we can, but there may be times where we only find out a week before it's going to, you know, a regulation that's going to go back into into effect. So it's going to be very challenging for us, and we're going to just have to really make sure the communication is there.
Well, we're here to help, add to that whole list and litany, the people's need to make sure they have insurance coverage and managing all the changes and shifts that are going into effect around that. So we have another question, and I open this up to anyone, which is just what have the challenges been regarding the encountering drug and alcohol addiction during this pandemic? I know we have instituted the Doorway program to be available anytime. We had developed all kinds of teaching and Project Echoes and efforts to secure providers who can engage in harm reduction and prescribing to support people with opioid use disorder. And we're seeing just an overwhelming increase in the number of sort of methamphetamines that are impacting communities. What do we see as our efforts collaboratively around telehealth and teleaccess to care that may help New Hampshire continue to support populations who are facing substance use and alcohol addiction?
Lucy, I want to start with that one because I think UNH has really been an important part of the solution. We have been successful in getting 2 USDA grants recently, and the most recent one has worked to connect UNH and provide resources to some of the recovery centers to improve their ability to connect with their clients for service remotely, because it's affected everything. I mean, everything we knew about direct face-to-face recovery services has been kind of exploded over the past pandemic because it just had to stop. So how do you provide that support and care during the most critical time of stress and no work and everything else that we know set people up for either relapse or entering into an addiction problem to begin with? So we've been really focused on that. And UNH Nursing has also been making sure that all our nurse practitioner students graduate to be able to be waiver eligible for when they practice, which some of your audience may not understand, but they can actually help prescribe really effective treatment for people with an opioid addiction. So that's been very, very powerful for us to be engaged in. I have to say, one of the things, the other thing that the state has done is all the health professional boards, I think, participate in the New Hampshire Health Professional program, which is for any professional that is experiencing a behavioral health issue, an a substance use disorder issue, not just for people that are diverting, but people that self-identify with a drug or alcohol. And let's be honest, let's not forget about alcoholism during this time. We know the opioid crisis is huge. We know that methamphetamines is a huge issue, but overall, alcoholism by far is also continues to be a challenge to all our communities. So again, social work programs are doing a really great job at working with that. We work transdisciplinary with treatment and recovery services, helping our students understand that. And we see this as one of our primary responsibilities in our telepractice center and through the College of Health and Human Services to improve education of our students, to make sure there's service learning going on in the community, and to help clinicians in any way we can help them provide services. So yeah, I think you brought up a really, really important point. The stress of this pandemic cannot be underestimated.
Yeah, and thank you. And as we see in New Hampshire, oftentimes with anything, we respond, and then the real sort of deep impacts unfold over time, which is why we're talking about, you know, a system under pressure, and certainly the impact of the stress and mental health is something we really need to focus on. And thank you for bringing up just how we are helping to educate and train around substance use and substance use disorder treatment in our communities. I query, as we are in our sort of next phase of understanding evidence-based care, what patients need the most, how to incorporate telehealth in this. And I know that the recovery centers have been doing so much around group therapy and telehealth ways. And we think about how insurance coverage helps support that. how do we make sure we create a sustainable response so it's not completely dependent on surges of federal dollars to support it, but we can even continue it going forward into our future. And we have a wonderful question that's come in that isn't as much of a question as a statement about how women are bearing so much of the health and economic burdens. I mean, all of our families are, but women have really higher rates of COVID infection, higher rates of death, higher rates of unemployment. A lot of the caring for families at home have been burden on women. Is school in, is school out, is et cetera. And Danielle, I'd love to hear your perspective on, have you seen that impact your workforce? And how do we make sure that all, our caring professions are seen and respected in our communities and compensated as such, so that we can help support both women and men in these professions going forward? So I know that's a compound question, but I'll turn that general concept over to you and see what your response is.
I think just to I'm very heartened to hear about all the educational aspects that Jean just discussed, because I do think our system is very pressured by a lack of behavioral health access. In terms of our patients, it's been hard to get them access to what they need. And Wentworth Douglas has a concept of an orange pod, where we have a mental health kind of mini unit within our emergency department. Because of a lack of beds, it's actually affecting young people right now a little more than the adults, which may or may not reflect the stress or this ongoing issue with return to school. In terms of our supporting our practitioners and our students and our workforce, I think that's been a challenge. There's a lot of trying to reach them. For me, on a leadership level, there's a lot of reaching out. Wentworth Douglas is part of the Mass General Brigham system, so we've had access to Headspace. Anybody with an MPI has access to Headspace for free. We're strongly encouraging staff to utilize EAP, utilize any kind of resource out there. I think healthcare professionals in general tend to try to be very stoic. And I do think that is affecting the workforce. So that's going to probably be an ongoing issue for quite a while, where when we survive the crisis, the letdown after, there may be repercussions for a little while to be seen. And hopefully we continue all those systems in place of support and trying to help them, whether that's with encouraging loan forgiveness, working for non-for-profits to include, continue those types of programs. But, that's a larger level discussion.
Right. And as are many of these issues that you also, gracefully and bring up around the longer term impacts. And Melissa, your department isn't just the department that responds to COVID. That was an add-on. Your department also has to manage benefits and what kind of supports our families are receiving and Medicaid coverage, et cetera. So what do you see as the challenges going forward around ensuring supports and services for families in our communities going forward?
So I think that the challenges first are what is the world kind of going to look like? What is going to be allowed to continue and what will not, and what are we going to kind of have to wind back? So I think, not knowing about telehealth and other things is going to be a challenge. I think, families, our services are still there. The assistance and all of the services that we have been providing are all still there, but they have morphed at this point. They've grown into something that we've recognized the need, and Danielle pointed out the need for mental health. That's something that's been a significant burden to families and individuals. A lot of people with isolation and other things that we're seeing more mental health crisis occur now than we have in the past due to the isolation of COVID. So I think that there's going to be changes in the needs of the individuals, not necessarily in the services that we're providing, but in the needs. And I think that we're going to have to move forward and adjust to those needs and ensure that those things that have been very helpful during the pandemic, like telehealth and other type of fluid, the fluidity of the programs that we're providing, that is able to continue. And we're going to work very hard to do that. At this point, I think that the other thing is it's not just the services that are provided by the department, but for example, our Division of Children, Youth, and Families, there has been first there was a lull in communications around potential issues and abuse at home and things because kids weren't in school. Kids weren't going anywhere, and those typical reports that we got from teachers and others, we weren't getting as much, and so we had to do a lot more outreach. And now, how did we do that virtually? And now going forward, how do we move forward to ensure the safety of children? These are all. There are so many things that the department does, and that's just one piece of a much larger puzzle. So each of our services, each of the programs that we administer have been impacted.
So I feel like we need intensive, all hands on deck on these challenging issues we need to come together around. And I know we're running out of time, so I'm going to ask sort of a quick question for each one of you to sort of fire back a response. And it's about this question that Heather brought up around interoperability. So you brought up before, there's this question of privacy. So people have the need for privacy around their care and their personal issues. Yet at the same time, we are striving to create large systems of communication so we can find people where they are and get them what they need and share the information that's important for us to support people in their services and supports, and just anything, whether it be getting them to the right vaccination location. And so we have that constant need to support interoperability. And what I'd love to just ask, we're not going to solve the problem of broadband and telehealth and interoperability and big systems right here, but I'd love for you to just tell us one pathway, one communication, one partnership, one way you were able to bring together resources that transformed what you could do in your immediate sphere. So think about that. If there's one thing you want to name, and I will just say, I feel like Zoom and the ability to meet with people at any time face to face has brought together sort of interdisciplinary problem solving. So we've been able to all talk together around challenges, which has been hugely instrumental. But maybe I'll start with you, Danielle. What have you seen in terms of communication that's made a difference to your patients and your staff?
I mean, Zoom really is a good example because I've used Zoom to communicate with the OTs in the state because we've had a lot of forums with all the OTs in the state. Zoom is the platform that Epic was using to provide telepractice and telemedicine. And Zoom's really been when we can't have meetings in person because we couldn't have people closer than 6 feet. That's how we've even communicated within our own hospital between interdisciplines to provide excellent patient care. So communication resources and the availability of a larger structure to allow communication between distant parties has been amazing in creating that safety net for patients.
Thank you, Danielle. And Jean, real quick,
I think interoperability can be interpreted as really transdisciplinary education, that we're all in the business of behavioral health. So when we talk about the really deep importance of behavioral health now and into the future, the contributions that the UNH grant had for getting OT into the behavioral health field and expanding that getting people to understand their role was really powerful. Us working with social work, our psychiatric nurse practitioner program. I think all of us are talking about being interoperable in a behavioral health world. I know that may not be quite the answer you wanted, but I think that's really important to understand the transdisciplinary work that's going on here and how important that is across all our disciplines.
Thank you. And Melissa, feel free to answer the question or just tell us how we can help you going forward with your work.
I think that from my perspective, the flexibilities that occurred over the last year in all areas of healthcare and in regulation and with the emergency orders has really opened the state's eyes to possibilities in general. And so there's so many things I could pinpoint, but I think just, everyone keeping open mind, being able to think outside the box and understanding that these flexibilities have created better outcomes for individuals. That's what really matters. And so I think that that's what I'm going to continue to try to work on and would love your help on it.
Thank you so much. And thank you so much to our panelists. You all are amazing. Danielle, Jean, and Melissa, let's get back together again soon. And to our participants for listening and the alumni efforts at UNH to bring us together. And of course, our event sponsors, Genia and Heather in absentia, thank you so much for supporting this great learning session together.